Hello and welcome to another remote edition of Currently in Quincy. I'm Joe Catalano, and on today's program we will chat with 8th District Congressional candidate Dr. Robert Goldstein, who's challenging incumbent Stephen Lynch. First, though, we check the news for you. Currently in Quincy, there are 1,220 cases of coronavirus, an increase of only 2 over the past 2 days. Deaths have remained steady at 121, and over 980 people have now recovered from the virus here in Quincy. Today and tomorrow would have been high school graduation ceremonies in Quincy before the coronavirus pandemic hit, but there will be video tributes to the class of 2020 shown tonight right here at QATV at 6 p.m. Actual in-person ceremonies at Veterans Memorial Stadium are now planned for late July 24th at 6 p.m. for North Quincy High School, July 25th at 10 a.m. and 4 p.m. for Quincy High School, as School Committee Vice Chair Anthony Andronico explains.
On July 24th, Friday, at 6 p.m., North Quincy High School will have their graduation. Everyone will get 2 tickets that will need to be pre-registered ahead of time for students to bring family members or people that they'd like to see them graduate. And we're going to hold them to 2 tickets apiece. We'll be very strict about that. Quincy High School will have their graduation the following day, and it will actually be 2 graduations. So the first half will be at 10 a.m. for students, half of the students sorted alphabetically, and the other half of students alphabetically will have theirs at 4 p.m. And the same guidelines will apply regarding number of individuals they can have as guests. Everyone will be required to wear masks. Individuals under 5 years old, those with pre-existing health conditions, and those 65 or older are discouraged in general from attending. Those are the guidelines according to the state. But at the very least, the community was pretty vocal that we need to do everything we can to give these kids a shot at having the same experiences that everyone else does. And I think, while not perfect, this plan does allow us to do as much as we possibly can for them.
Now, Andronico says it's still unclear if the band or the choir will perform, and the distribution of diplomas has not yet been worked out. At this coming Wednesday school committee meeting, Superintendent Rick DeCristofaro will officially declare the class of 2020 in Quincy as graduated. Quincy City Council is expected to approve the next fiscal year's $340 million budget at their meeting next Monday night. The council president, Nina Liang, says there are still some questions about $2 million for health insurance for Quincy College employees.
We, again, got a very, it was a level funded budget that we received from the administration and from all the departments. And so, aside from some questions that we had here and there's some clarifying questions that we had for some line items in the way that they were worded, everything, again, came in level funded. There were no increases on anything, not even the cost of living increase, no new positions or anything like that. So, yeah.
Although self-sustaining, Quincy College is still considered a city department, and the city would have to pay for that insurance if the college is unable. Quincy City Hall is open to the public today for the first time since the pandemic hit. People are being asked to wear a mask and respect social distancing if they do go to City Hall. Residents are still encouraged to conduct business online or by phone or by mail or email if possible, and to try and call ahead before coming to City Hall. Business at other city buildings, including at Coddington Hall and the DPW, are still by appointment only. Over 20 tons of food donated recently to Interfaith Social Services of Quincy and the Weymouth Food Pantry. The Church of Jesus Christ of Latter-day Saints collected the food. Volunteers recently unloaded this huge tractor trailer at a Rockland warehouse. The food will be distributed to Interfaith Social Services here in Quincy and the Weymouth Food Pantry soon. A church spokesman praised its members for collecting those donations, which will translate into 42,000 meals. Directors of local food pantries say they have seen an unprecedented number of people seeking assistance since the pandemic outbreak in early March. Coming up, we talk with 8th District Congressional candidate Dr. Robbie Goldstein next.
Throughout our city's long, proud history, the people of our community have always stepped up in times of challenge. The public health crisis we're facing together today is no different. I can't tell you how many people over the last several weeks have called with a very simple question: how can I help? I'm so heartened by this deep sense of community. That's why we're launching the Quincy Relief Fund to help support our friends and neighbors in Quincy hardest hit by this crisis. All monies raised by this effort will go directly to individuals and organizations in the most need during this difficult time. The program will be administered by the Quincy Foundation, a registered 501c3 nonprofit corporation with a mission under normal circumstances to provide charitable contributions and put on the Flag Day Parade and our local Christmas festival activities. Please go to thequincyReliefFund.com to find out more and donate. My friends, our community is strong. Our commitment to each other is strong. We will get through this together, and any support you can give our neighbors right now will go a long way. Let us keep in mind those that have been affected in your prayers. May God bless you, and stay safe.
We're pleased to virtually chat with Dr. Robbie Goldstein, a candidate for the 8th District congressional seats here in Massachusetts. Doctor, nice to meet you, if you will.
Great to meet you as well. Thank you for having me on.
No, it's our pleasure. You know, when I first found out that Congressman Lynch had a challenger, I was surprised, and I'm guessing a lot of other people are too. So I thought this would be a great opportunity to let you introduce yourself and talk a little bit about your platform.
Absolutely. Thank you. Yes, the congressman has been in office for quite some time, since 2001, and has not had many challengers in his time, but it does feel like the moment for a campaign to come in and challenge him and bring a fresh perspective to this race.
So when actually did you enter the race?
We launched the campaign in November and have been building ever since. It was obviously a very different campaign in November, December, and January before COVID happened, but we have continued to push forward despite the changes that we had to put in place for social distancing and to be safe.
So as I mentioned, you are a doctor. You are at Mass General, is that right?
Exactly, yeah. I'm an infectious disease doctor by training. Much of what I do at the hospital is primary care for people living with HIV, folks in the LGBTQ community, and people affected by substance use. And in particular, actually, about 5 years ago, I established the Transgender Health Program at MGH, and I'm the medical director of that program and provide care to trans and non-binary folks.
Okay, so what was it that prompted a physician to get into politics? Was there a singular event that occurred, or what's the impetus behind the campaign?
It wasn't just one thing, that much is clear. It was something that was building over time. I actually think that there are a lot of similarities between medicine and politics, or working in the hospital and working in government. At its core, medicine is about making sure people can be healthy and live a better life. Government should be the same. And I really believe that the government should be about guaranteeing everyone a healthy life. What sort of came together for me and what I recognized over the past 10 years of practicing and being a primary care doc was that I was hearing from patients the same stories over and over again, the same challenges that they were facing. And they weren't necessarily about how do you access healthcare. They weren't about the insurance card that everyone has in their pocket. They were about limited access to housing, limited access to food security, a job that doesn't pay a living wage, a transportation system that isn't working for them. All of those were coming together and making things more and more challenging for my patients. I especially saw this with the trans non-binary folks as we were building the transgender health program, that those that are most vulnerable in many ways are disproportionately impacted by all of those social determinants of health, like housing and food security. And I recognized that something had to change, right? We had to do something, and it was time for a fresh perspective to begin to address what's going on. I think in particular, a physician has a really great ability to bring that fresh perspective, because we really do have to focus on making sure everyone can live a healthy life.
So I'm sure, many physicians see that with their patients. What is it about you that caused you to take action and actually seek some change?
I'll go back to the work that I did in the transgender health program. I mean, I think that was a formative experience for me in many ways. It showed me the power of what can happen when you dedicate time and resources to helping communities. It showed me that you can bring people along to do what is right, and to really push forward to support those communities that are most vulnerable. And it allowed me to begin to interact with people beyond the hospital. I began interacting with community organizations, with government, with people all across New England. And I recognized that there was a bigger space out there than the hospital, bigger than just that exam room that I was with my patients one-on-one. And I could really use some of those connections that I was making to begin to have a conversation and then begin to expand the impact that I might have.
So is societal change part of your background? Tell us a bit about yourself personally, if you could.
Yeah, so I actually grew up in upstate New York. I wasn't born here in Massachusetts. I grew up in a small town where my dad was the dentist in the town and my mom managed the office. And it was this family business that they ran. I would go with my sister after school to the office and we would be a part of the business. And that business was all about taking care of our community. It was about investing in the neighborhood. It was about making sure everyone could walk in the door and get the care that they needed. That inspired a lot of what I do now and how I live my life. I came to Massachusetts 20 years ago. I went to Tufts for undergraduate, and then I stayed to get an MD and a PhD before I went over to Mass General to do my training in internal medicine and then infectious diseases. So it wasn't a long, history of system change that I had coming into this. I did the medical school path, right? I went to school and did all those steps to becoming a doctor. But I was recognizing in each of those phases of my life how important systems are and how important it is to have people stand up and use their voice to push forward for the communities that we're all living in.
Okay, so what is some of the unique needs you see in the 8th district? First of all, where do you live in the 8th district?
So I live in South Boston. The 8th District, as people are aware of, is a pretty big area of southeastern Massachusetts, 24 cities and towns, starting in Boston, going all the way down to Brockton and Bridgewater, over to Scituate and Hull and Walpole on the west side. When we were able to get out there and meet with folks and shake hands and answer questions in person, I heard repeatedly that the number one issue on people's minds was healthcare. This was all before COVID, right? This was all before we knew what we were going to be hit with in March. Since then, since March, it has become incredibly clear that we need a healthcare perspective, one that is, as I said earlier, broader than just about healthcare access, one that recognizes that housing is healthcare and transportation is healthcare and climate change is healthcare. And so I hear from folks when I'm talking to them how eager they are to have that voice in Washington, a voice that comes from the healthcare world that can help us get through the pandemic we're living in right now, build to a society that is more just, and prevent the next pandemic that may be coming.
So do you support single-payer healthcare, Medicare for all, the discussion that's been happening for over a year now?
Yes, yeah. So yes, I'm a firm believer that the way out of our healthcare crisis is a move towards a single-payer healthcare system. I think that is the only way that we'll be able to expand access to everyone in this country. It's also the only way that we'll be able to control costs of healthcare, which we really need to. But I really do think that is a process that this country is on. We are moving towards a single payer system, whether people are aware of it or not. And what we want are the experts in Washington to help us move in that direction. That's bringing more physicians, more medical professionals down to Washington to be a part of the conversation.
So what about funding such a program? Where would that come from?
Yeah, so I actually think the better question is how much money will we save when we transition to a single payer healthcare system? Right now, we're spending trillions of dollars a year as a country on our healthcare, and the costs go up year after year. We've got to get to a place where the costs go down year after year, or at least are staying stable. I really believe that the only way to do that is to move to the single payer system. Will there be some upfront costs? Absolutely, but we're going to recoup those costs within 5 to 10 years as we're able to control the rising expenditures in healthcare.
What did this pandemic reveal about the healthcare system that maybe folks weren't aware of before? What are some of the glaring deficiencies that you see?
Yeah, I mean, even before the pandemic, right, and I've been working in the system for a while now, it was clear to so many about the disparities that exist in healthcare. The fact that the color of your skin oftentimes dictates the care that you receive. Where you live may dictate your ability to access the level of care that you need. That became glaringly obvious to so many of us during this pandemic, where we saw the disproportionate impact in communities of color, in areas like Brockton in the district, in areas like Chelsea, even in parts of Quincy. We also became very aware that geography was really important. It also became clear that climate change was important. And we saw the Attorney General came out with a really amazing report that showed that those areas most impacted by climate change also had the highest amount of COVID infections. And so I think something that I had seen for a while, and something that was part of this campaign from the beginning, became clear to everyone that these issues are all interconnected. Healthcare justice, climate justice, economic justice, racial justice are all interconnected.
So was the Affordable Care Act on the right track, do you think?
I do. I think the Affordable Care Act in 2010 was the largest expansion of healthcare coverage that our country had seen since Medicare and Medicaid. I think it was absolutely the right decision at that time. I'll point out that Congressman Lynch, my opponent, voted against the Affordable Care Act in 2010, which I think was a really terrible decision, and a decision against healthcare expansion. I think we're now in a different place. We're 10 years later. We have seen what we can do with that mandate to expand coverage, and we've got to move the mandate further. We've got to push further to make sure that access is guaranteed all across this country.
I think one thing that was quite obvious and surprising to me, and maybe a lot of folks, was just the unpreparedness with basic necessities like PPE and respirators and ventilators. Is that a product of the privatization of the healthcare system, do you think?
I think that's more of a product of what our government has done over the past decade. When we go back and look at the Affordable Care Act, one of the really important pieces of the Affordable Care Act was a specific investment in public health infrastructure to the tune of around $8 billion between 2010 and 2020. We were supposed to invest in the CDC, in the NIH, in all of our emergency preparedness stockpiles. And what happened was that the Republicans in Congress and now the president have really stripped away that funding year after year. And without the money, we weren't able to maintain our preparedness levels.
So does that require legislative action on the part of Congress to change?
I think it does. I think we need certainly legislation out of the House and the Senate that will boost funding levels for our emergency preparedness, the CDC and the NIH and other committees. I think we need legislation that will guarantee our commitments to the World Health Organization and get us back aligned with the international community to make sure we're working on this together. But the other piece of Congress, and the piece that really I think was lacking in many ways over the past 10 years, was the oversight. Congress has the ability, the authority, and the expectation that they will provide oversight to the executive branch. And when decisions like stripping funding from the CDC are made, when decisions like removing ourselves from the WHO are made, Congress has the ability to really apply pressure and use that oversight function. And so I'd like to see, once I'm elected, Congress really using that oversight to limit an executive branch that may be pushing in the wrong direction.
I should ask, are you running as a Democrat or an independent, or what's the party affiliation?
Yes. So I'm running in the Democratic primary. I'm a lifelong Democrat,
Okay.
and I'm running as a Democrat.
Okay. If elected, will you continue your physician duties as well?
So I will always be a physician. I will say that being a physician is so much more than just being in the exam room. It's a way of thought. It's a way of bringing my patient stories in. I will likely have to walk away from being a primary care doctor and that longitudinal relationship I have with my patients. It's not fair to them to have me split between two cities and not be present for them when they need me. But I have been cautiously thinking about ways that I can continue to provide patient care and direct patient care when in Washington and in Boston, because I do think it's a really important part of my life. It gives me an opportunity to talk with people, to hear from them. As I said at the beginning, this whole campaign was really driven from the stories that I heard from my patients and the challenges that they're facing. And I think it's important for me to maintain that connection.
Will you be in the district often if elected? I know that the current incumbent tries to at least hold town hall type meetings. Do you think those are important?
Absolutely. So, I committed at the beginning of this race. One of the first things I committed to was holding town halls as frequently as I possibly could. Actually, Congressman Lynch went over 2.5 years without a town hall in the district, without meeting with constituents. I think it's important to have those conversations. And so committed to doing one each month of the first year that I'm in office, which would require both that I'm in the district, right, and that I'm getting out there and meeting with people all across the district. There are parts of this district that have not been visited by the current congressman. It's a big district, 24 cities and towns. All of them deserve a voice in Washington.
I'm curious, do you think this new, due to the pandemic, this new form of communication, these interviews via teleconference can be utilized post-pandemic?
Yeah, absolutely. I mean, I've been joining a bunch of Democratic town committee meetings and organizational meetings that are all being done on Zoom now. And I think it's a really great way for us to continue to communicate. It doesn't replace in-person meetings. And I think I am really looking forward to the time when we can get back to some of those in-person meetings. But it does make it so that there's no excuse. Right? If I'm in Washington, there's no reason why I can't log into a Zoom chat and have a conversation with people in Quincy at the same time.
I can't help it. You kind of capitalize on your background as an infectious disease specialist. We're going to come through this pandemic, doctor. Do you see light at the end of the tunnel?
I do. I think we're strong and we can get through this. And I think that we have amazing people that are working on the front lines of this pandemic, both in the hospitals and in the research labs trying to get us through this. I do think that the way through this is the scientific process of developing a vaccine and developing a treatment. I've seen progress in both of those arms in ways that I've never seen for any infection before. We have put a tremendous amount of resources behind developing a vaccine and developing a treatment, and I am optimistic that we will see that come through in the coming months. Until we get there, though, we're still going to be in for the social distancing and some of the discomfort and in some ways the loneliness of being inside our homes and not being able to share things with our close friends and families.
Sure. Has the medical community, do you think, learned anything from this for a potential other pandemic?
Definitely. And one of the things that I keep saying, and I talk to my friends in the hospital about a lot, is sort of shame on us if we go back to the system we were using before, right? We have an opportunity here now to build something better, to build something bigger, to be bolder in our response. I think the medical community certainly has been awoken by everything that is going on, that we're seeing in the disparities of who is getting this infection and who is dying from this infection, the ability of us to transition our care to virtual care, the ability for us to get out to the communities in ways that we weren't able to do before. And I would love to see us continue to build on that as we go back to a more interactive society.
I would be remiss if I didn't ask you to comment on the events of this past week with regard to the George Floyd case in Minneapolis and the resulting actions and your feelings about that.
I have to say I have been listening, and I have been thinking, and I have been reflecting for the past week. I was very, I think the only word I can use here is that I was uncomfortable through the whole week. And I think that that was a good thing. I think that I need to embrace that discomfort. As someone who is a white man with a certain amount of privilege, a lot of privilege, I need to own that I am uncomfortable and own that that's something I need to work through. I have been really encouraged by the voices I've heard, by how loud those voices are in their fight for justice. I think that people are angry, and I think that they should be angry. What I am really hopeful about is that we are seeing changes locally, we're seeing changes at the state level, and we are hopefully seeing changes at the federal level. And this week has given me the opportunity to think about, if I was in Washington, what would I be doing right now? Certainly I would be joining Congresswoman Presley in her march for this resolution to speak out against police brutality. I would be joining others in Washington to talk about getting rid of qualified immunity. I would be talking about the Eric Garner Excessive Use of Force Prevention Act. I would be talking about ways that we can bring humanity and dignity into the criminal justice and the criminal legal system. I think there are a lot of really great ideas that are out there, and I am hopeful that we are going to elevate those all with our anger, with our voices, with our actions over the past week and in the weeks to come, so that they get through the House, they get through the Senate, they get signed by their president, they become the law of the land, and we can begin to build towards the just society that everyone is fighting for.
Do you think that institutional racism is an issue in the 8th Congressional District?
Absolutely.
Really?
Absolutely. I think that there's institutional racism all throughout our society, right? And I think we have to recognize what is in this district. This district includes Mass General Hospital, the place that I work, the largest employer in the district, that certainly has structural racism that is built into the institution. We're fighting to make it better. We're fighting to be more just, but it exists. I think we have to think about how the lines were drawn in this district. There are certain communities of this district where the line between the 8th and the 7th Congressional District goes right through the center of the street. And the reasons for that have a lot to do with structural racism and institutional racism. And we have to really consider that, right? And I think we have to think about even sort of the institutions of government, right? Who is elected in this district? Who has been able to use their voice? Who has been able to lift up the communities? And I think that there are historic structural racism issues that are present there. The conversations we're having now are helpful. The conversations we're having now are not enough, and we have to keep fighting to move towards that more just society.
What is your campaign strategy in a coronavirus world, Doctor?
So it's to lean on my strengths, which are that I'm an infectious disease doctor, and we're going to be consciously doing things that are promoting public health and not doing anything that is going to risk anyone's health for this campaign. Our strategy has been since November and continues to be since March to meet as many people in this district as possible, to meet them over the phone, over text messages, online, on Facebook or Twitter or Instagram, to meet them in any way possible so that they can hear from me, hear my story, hear the message of this campaign, and hopefully join me as I'm trying to bring my values and what I think are really the shared values of people all across this district to Washington.
Anything else you'd like to add today?
Just thank you for having me on. This was great to have a chance to speak with you, and hopefully we'll get to do it again soon.
Yeah, hopefully in person. And for folks who'd like to reach out, what's a good way to do that?
Best way to reach out is to go to our website at robbieforchange.com. You can learn more about me and get connected with the campaign.
All right. Thanks for your time, Doctor. Good to talk to you.
Thanks as well. Great to talk with you.
Special thanks to 8th District Congressional candidate Dr. Robert Goldstein for joining us today. Thanks to our crew working remotely from home. Thank you for watching. A reminder, please take part in the Quincy COVID Memories Project by submitting your experiences during this pandemic to quincyculturalmemory.com or mailing your submissions to the Thomas Crane Library. Attention, Local History, 40 Washington Street, Quincy, 02169. We here at QATV are teaming up with the city, Quincy 400, and the library to collect videos, photos, artwork, essays, or any other reflections of the pandemic here in Quincy. And also, please visit our newly redesigned website, qatv.org. You'll find all of your favorite programs, along with news and information, video on demand, and now live streaming. For all of us here at Quincy Access Television, I'm Joe Catalano. Please stay safe.